Health assessment is important in nursing, and for mental health nursing, you'll need to make a mental health assessment. It's been said that mental status is the cornerstone of mental health nursing, and these are the basics from which you'll make your assessment. For a mental health assessment, start with a general description of the client's appearance, dress, grooming and hygiene, facial expressions, and eye contact. The next step is motor activity, the client's physical activity. Does the client move very slowly with very few gestures, or is he restless, agitated, hyperactive? The third step in the assessment is speech. Is it rapid or slow, loud or soft, slurred, difficult to understand? Mood is the next step in the mental status exam. This is more of an interaction between you and the client as you assess his mood. Like, how are you feeling today? If you suspect the client might be suicidal, ask about those thoughts. Does he have a plan? Does he have the ability to carry out that plan? Affect represents the client's emotional state through facial expressions, hand and body movements, and pitch of voice when the client is expressing feelings. Now perceptions. Is he having hallucinations? Hallucinations involve any of the five senses: hearing sounds or voices that others can't see, peculiar odors that others can't smell. There are two key questions here. Are you seeing or hearing things? Yes? What do they look like? Or what are the voices saying to you? Rather than a hallucination, it might be an illusion, a misinterpretation of environmental stimuli. Instead of seeing a curtain by an open window, the client sees a person standing there. That's when you look to the client's thought content. This is where you, as a nurse, really question the content of what the client is communicating and thinking. Do you worry about specific issues or have recurring, persistent thoughts? Do you feel like things are strange or unreal sometimes? Do others watch you? After thought content comes thought process. That's the how of client communication. Is his speech clear, logical, and organized? Next, assess orientation or level of consciousness. Some clients are offended by the routine questions of place, person, and time. You may have to get creative. Instead of, do you know what time it is? Try, how long have you been here? For a person, you can ask, what kind of work do you do? Are you married? Do you have children? This leads us to recent and remote memory. For example, if a client reports that he was admitted to the hospital 2 days ago, check the hospital admission assessment. Or if the client mentions a history of high blood pressure, validate that remote memory with his medical history or the results of his physical examination. After spending some time with the client, you'll assess concentration. Can the client pay attention during the interview? Then intelligence. In assessing intelligence, there are several indicators to look for: completion of school, general knowledge, vocabulary, and literacy. Be sure to account for local dialect and acceptable grammar usage in the area you're practicing. Look for the ability to abstract with proverbs. What's the meaning of the proverb, when it rains, it pours? Judgment and insight. Judgment involves understanding facts and making decisions, such as a client with schizophrenia telling you he doesn't need medication. What's your assessment of his judgment? Insight is the client's understanding of the illness or problem. Sometimes a client blames someone else, like his spouse, or your client with bipolar disorder says she's only in the hospital for a physical checkup. What's your assessment of her insight? These are the components of a mental status exam. You may find that several of them are apparent immediately, while it may take observation and the correct questions to assess the rest. Remember, every interaction involves assessment of the client's mental status, even when the client is unable to communicate.